Kidney disease and refrigerator? Hello? This is your Healthy Life channel. We always produce videos for your health management with information from Korean healthcare specialists and researchers in related fields. Is there anyone who hasn't subscribed yet? Please subscribe and like right now. And please share it with your loved ones so that everyone can live a healthy life. For reference, the average life expectancy of Koreans is currently 90 years for women and 86 years for men as of 2024, which is one of the longest average life expectancies in the world. It has increased by more than 5 years compared to 10 years ago, and the average life expectancy of Koreans is increasing every year. I hope you all always watch our Healthy Life channel and maintain a healthy life. There is no definite treatment or special treatment for kidney disease in modern medicine, regardless of the East or the West. Because of this, once kidney disease develops, it progresses and worsens. Perhaps because of this, there is a widespread perception that kidney disease cannot be treated once it develops. One of the reasons why the treatment of kidney disease has remained stagnant is that the incidence of kidney disease is not that high compared to other diseases. Since the incidence of kidney disease was relatively low compared to other diseases, research on treatment methods was also poor. However, things are much different now. Since the Industrial Revolution, our living environment has changed significantly, and the incidence of kidney disease has also increased rapidly. Would it be an exaggeration to say that the background is not unrelated to the popularization of refrigerators? Let's reveal the secret hidden between the rapid increase in kidney disease and refrigerators. It is true that the popularization of refrigerators has drastically changed our lives. The eating habit of cooking and eating seasonal food in a timely manner is now a thing of the past. Our eating habits have changed dramatically as it has become possible to preserve food for a long time regardless of the season. We can now eat fresh fruits and vegetables at all times, and long-term storage of meat and fish has become possible. At the same time, it has also made a great contribution to the complete eradication of scurvy. However, unexpected side effects have also emerged. Most foods are kept cold in the refrigerator, and as we start to eat mainly foods kept cold in the refrigerator, the health of modern people is at risk. The author considers the refrigerator as the representative home appliance that threatens our health. This is because as we eat more foods that are kept in the refrigerator regardless of the season, rather than cooking and eating seasonal foods that are naturally grown, our health is threatened to that extent. Among these, kidney disease, which has increased rapidly, is also at the center. This is because kidney function is also greatly affected as we start to eat mainly cold foods. If you wear thin clothes on a cold day, you are more likely to catch a cold. The same goes for cold foods. Eating cold foods makes your lower abdomen cold, and as harmful bacteria in your intestines multiply, it causes indigestion and diarrhea, and your immune system also decreases. And that's not all. If you continue to eat cold foods, your body's circulation will not function properly, and it will have a negative effect on your internal organs. Kidney function is no exception. Among the 5 internal organs and 6 organs, the kidney belongs to the water element in the 5 elements, so it is an organ with a cold nature among the 5 internal organs. Therefore, if you eat a lot of cold and cold food or keep your body cold, you will urinate frequently, and if harmful energy enters the kidneys, kidney function can easily be damaged. Thanks to the refrigerator, we can eat cold food all year round, and the storage period has been greatly extended. It is certainly a thankful thing, but we must remember that the rapid increase in kidney disease patients and the popularization of refrigerators are by no means unrelated. Kidney disease is a disease that can be overcome. In modern medicine, kidney disease is considered a difficult disease to treat, but in conclusion, kidney disease is a disease that can be overcome. This is the conclusion I have reached after treating various kidney disease patients for over 40 years. Treatment of kidney disease using Oriental medicine methods is producing very hopeful results. Among them, there are cases where even patients who are said to be incurable at the hospital have been cured. The medical judgment that nephritis or kidney disease is bad in Western medicine is determined by a doctor based on the results of blood tests, urine tests, or CT scans, and medication, dialysis, or transplant surgery is performed accordingly. If nephritis becomes chronic, kidney function is lost, and when about 80% of the entire kidney is lost, dialysis is required. Even in this condition, there are many cases where improvement was achieved through the 12-seed therapy and agarwood, which are Oriental medicine treatments for kidney disease. The effects can also be confirmed directly. This is because, depending on the symptoms and constitution, medication is administered for a certain period of time, and then the patient is asked to go to the hospital for a test. In many cases, normal values are shown. In other words, this means that the function of the damaged kidney has been restored to its original state. In conclusion, it is not appropriate to say that kidneys that have once deteriorated cannot be restored to their original state. If you know the characteristics of Oriental and Western medicine and get rid of deep-rooted prejudices, you should definitely remember that kidney disease is a disease that can be sufficiently overcome. Let's learn about the dietary guidelines that help maintain kidney function. 1. Eat raw vegetables boiled as much as possible. They are easy to digest and absorb, and are good for kidney function. 2. Avoid raw fish and eat white, red, or gray fish cooked. 3. Meat should be minced into small portions and eaten about twice a week in golf ball-sized pieces. 4. Tomatoes should be cooked before eating. However, tomatoes are absolutely prohibited during kidney disease treatment. 5. Fruits should be baked or dried before eating. You can eat them as jam or canned fruits. However, diabetics should eat very small amounts of raw fruits because of the sugar content. 6. Seaweed should be grilled with sesame oil. 7. Eating a lot of vinegar foods improves kidney function. It is good to pickle cucumbers, peppers, garlic, and onions in vinegar. Was today's content helpful? Don't forget to subscribe and like and set notifications, and click all of them right now. I will come back next time with more useful content with useful information from Korean health management experts. Thank you for watching.